Danisha, you can do a roll call whenever you're ready.
Can you hear me, Chairman Boyd?
I do hear you. You can do a roll call anytime you're ready.
Yes, sir. I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Cynthia Rucker,
Here.
Shane Mobley,
Here.
Robert Coles. And I will note that Dr. Coles provided notice in advance that he would not be able to join. Chairman, that concludes my roll call.
Thank you, Danisha. We'll thank everyone for joining us this morning for the audio only Zoom call for our meeting today, as the department is in the process of moving locations, and hopefully next month we'll be back to a more normal setting. Again, thank you all for joining. Our meeting agenda this morning consists really for the board to consider three different items. One will be consideration and be asked to vote for final approval. The other two will be initial approvals. So with that, I move right into our agenda. The subject of the approval of the minutes of the March 9 meeting, and I'll ask our secretary, Dr. Cynthia Rucker, if she's had a chance to review those minutes and can recommend their approval.
Yes, good morning, Chairman. I have reviewed the minutes for March 9th, and I do find them to be in order and recommend them for approval.
They're recommended for approval of the minutes for the March 9 meeting. Is there a second to that?
This is Dr. Lee. I'll second.
That has been seconded. All in favor say aye.
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 Opposed? Abstaining? Hearing none, they are approved. Thank you very much, Dr. Rucker. With that, I'll turn it over to Commissioner Noggle for the commissioner's report.
Good morning, Chairman, Board, and members of the board. Can everyone hear me okay?
Just fine.
Great, thank you. And thanks for your patience as we move this week. I was actually in our new office space yesterday trying to get settled. It's an active, almost construction zone, but there's a lot of progress happening. And I just want to take a moment to give a quick shout out to our human resources, facilities and support team, IT, and our partners at GBA. This is a significant undertaking, and we are so appreciative of their efforts. There will be bumps in the road, boxes will get lost, things will get broken, but we are going to be all the better for it and very excited about our new shiny space and can't wait to host you all back to potentially an in-person board meeting or at least some sort of a convening of us all in our new space pretty soon. So excited about that. And we'll be back to at least some normal operation here pretty shortly. A couple of just quick updates for everyone today. Obviously, the session adjourned about 2 weeks ago. We are still, the governor's obviously in his bill review period, so we are still pending final disposition of a number of bills that will impact either directly or tangentially the department. And we'll be sure to update you those as those are signed. Notably in the budget, the amended budget was signed by the governor. It included a total of a $225.6 million decrease for the Department of Community Health, largely due to continued federal cost sharing or FMAP changes as a result of kind of the ongoing enhanced funding from the feds as we get through the end of the public health emergency and Medicaid unwinding. For FY24, we saw a total of a $295.5 million increase to the department's budget. Again, mostly due to some FMAP adjustments and then utilization. I will note a couple of specific significant items. Most notably, almost $1 billion in other funds will be recognized for the state health benefit plan in terms of increased employer contributions in the teacher and both certified and non-certified school personnel parts of our plan. So that's very welcome news and will bring much needed financial stability to the state health benefit plan. And we'll have further updates you on plan developments in the coming months as well. We will have significant budget items for consideration in amended 24 and 25. There were a number of things that were unfunded or additional items that the department will be instructed to undertake without additional funding. And so those will have an impact on our budget. We are starting to work on our year-end closeout numbers and projections for next year. So we'll have additional information about those numbers as we go forward. Obviously, certainly no later than August when we'll really present that to you, but keep an eye and an ear out for that. The biggest undertaking we have right now, obviously our CMO procurement is ongoing, but the end of the continuous enrollment or Medicaid unwinding officially began on April the 1st. I want to give a shout out both to our Medicaid director, Lynette Rhodes, as well as Melody Debussy from DHS, the Department of Family and Children's Services. They have really teamed up and are working in great partnership, really to make this possible and happen. It is a huge undertaking for us to collectively as sister agencies to redetermine eligibility for all 2.7 million members over the next 12 months. And I've been really proud of the work that they're doing. Redeterminations do begin this month. They'll start by doing them in batches. So we'll take a full 12 months. We'll take groups of Medicaid members at a time. They'll attempt to redetermine their eligibility on what's called an ex parte basis, basically using known data sources to try to redetermine a member's eligibility without actually having to get new documentation from the member. For those that we're unable to successfully do that on, or there's just not enough information out there, those members will start receiving notices on April the 15th. They'll have until about a 45-day full process for their eligibility to redetermine. So the first time someone would technically come off the Medicaid rolls would be June the 1st. So we've not seen a huge, at least on our side, a huge uptake or intake of phone calls or questions yet. I suspect that won't happen really until June when people really start feeling the impact of those redeterminations. We are continuing to work on outreach, both collectively and individually as agencies. If you are out in your community or have folks or provider groups or associations that would love to get some more information, please have them reach out to us. The Stay Covered website that was stood up has a lot of both member and provider information and community information available on it, but we are more than happy to get some folks out in the field and make some presentations to those that need it. We're also actively connecting our CMO, our care management organization partners, with some of our high volume providers and actually putting folks physically in place with hospitals and making those connections so that we can try to capture Medicaid member updated information as those members are actually coming in for services. And we'll continue to do some other things, including additional email outreach and file transfers with our CMOs to try to increase that outreach and connection. So lots of things going on. That's really our main focus right now. We have a number of procurements in progress that we'll continue to update you on, but that's our main focus right now. I'm happy to answer any questions, Chairman. Before I forget and pull up a different screen, as I always like to do, I just want to acknowledge our staff that are celebrating milestones with us. Kayla Arnold and Kiara Smith are celebrating 5 years. Celebrating 10 years of service to the state are Mina Andrews, John Cole, Kenesha Lopez, and Sandra Ogletree High. Kevin Banks and Marina Scott Fox are celebrating 15 years. Dolores Williams is celebrating 25 years. And our esteemed and treasured COO, Joe Hood, is celebrating 30 years of state service. And I certainly wouldn't be able to do what I do without Joe and the rest of the team. So I just want to extend, again, our kudos and gratitude to all of our employees celebrating those significant milestones. I'm happy to answer questions, Chairman Boyd, but that would conclude my report for today.
Thank you, Commissioner. Are there any questions, comments from the board, please?
Mr. Chairman, David Cruz, one quick question for the commissioner.
Yes.
Commissioner, I think I heard you say that in the redetermination efforts that there is some effort to do that without having to contact the member. Could you say a little bit more about exactly what that is?
Yes, sir. To the extent that I know, it gets a little technical. So it's what we would call an ex parte renewal. Basically using our existing data sources and known information about members. And this is something that all states do, and we're being encouraged to do more and more, but essentially saying, all right, we know that member A is Jane Doe. Let's see if Jane Doe has wage or employment records with the Department of Labor or Department of Revenue or other data sources that we already have access to say, all right, we've been able to verify your income, you're still eligible, and not even have to require new documentation from the member. Or in the case of maybe a member on fee for service in the age blind or disabled population, yes, we communicate with Social Security Administration. We see that you're still on SSI disability, you remain eligible. And so don't even have to directly interact with a member other than to send them a notice and say, we've redetermined your eligibility, you remain eligible. Only after we've exhausted those efforts would we actually go to the member and say, unfortunately, we weren't able to find enough information on our own, or we found conflicting information. So we would like to request some additional information from you about your income and employment to verify eligibility. So it's trying to make determinations, for as many members as we can as quickly as we can without actually having to trade back and forth a lot of notices, paperwork, and files.
Is there any expectation of kind of what percent of that will be determined that way?
You know, I think there is, and I don't know if Lynette is on, I can follow up with you exact percentage. Federally, CMS is hoping that states get, north of 50, 60, 70%. I don't know exactly what we'll hit. We're trying to increase our ability to be really effective at that. But we're going to shoot for as high as we can get. But that's one of the metrics that we will be monitoring. I think we're in conversation about what are the normal metrics and reporting that we're going to want to monitor. And I think that's one of those things that you'll see us start monitoring and seeing how effective we are at that.
Thank you.
You're so welcome.
Other questions, comments from the board, please?
Cynthia Rucker. I just wanted to say to the commissioner, I appreciate that information and the question that was presented. I guess in the back of my mind, I'm wondering if we have an estimate of how many we think would potentially, and I know that's far reaching, could fall out from this or not be renewed.
We do. I mean, I think generally we have looked and tried to do some back of the envelope estimations. The Department of Human Services and Defects has done the same. I think we've heard numbers upwards of 20%, maybe 500,000 members of our 2.7 likely or potentially could fall off of eligibility. I think it's assumed that, there's a number of folks that will age out from eligibility, mothers that had a child longer than a year ago, since we are a fortunate state that's extended our postpartum coverage for up to a year, but someone that had a child a year ago, folks that income now exceeds, and hopefully we've transitioned them to another insurance service or coverage option in the state. But many of our age blind to disabled members would likely stay eligible. And we're being very thoughtful and considerate on when those members, in fact, are being redetermined so that our most complex members with the highest level of need, that we're trying to ensure their continuity of care. I think one of the things that you'll also see and hear more and more is that we're also trying to connect any member that loses eligibility from traditional Medicaid to additional categories of assistance, including hopefully our new Pathways program that we're launching or intending to launch with CMS with their partnership on July the 1st. And beyond that, for folks that either choose not to participate or are not interested in or don't qualify for Pathways, also making sure that we transfer them and make connections to the federal marketplace to look at other commercial carrier products.
Thank you, Commissioner.
Other comments or questions, please? Very good. Thank you so much, Commissioner, for that very informative update. We'll next move into the items we're being asked to consider for vote today. And the first is medical assistance plans for comprehensive support waiver. And Brian Dowd, or Deputy Executive Director of Medical Assistance Plans, will make that presentation, and our vote to consider will be for final adoption.
Thank you, Mr. Chairman. Just checking to make sure you can hear me.
Fine, I can hear you.
Great. Thank you, Mr. Chairman, Commissioner, and members of the board. I'm presenting today for final adoption a rate increase for Georgia's Comprehensive Supports, or COMP waiver program. At the February 9th, 2023 DCH board meeting, DCH proposed for initial adoption to increase the rate of reimbursement for all services within the COMP waiver by 5 plus 2% for a total of 7% across all services. The increase will make permanent rate adjustments made in accordance with legislative intent and temporarily enacted through Appendix K public health emergency provisions. The proposed reimbursement rate is estimated to increase expenditures within age, blind, and disabled Medicaid in the state fiscal year 2024 by $18,145,635 in state funds and total funds of $53,400,926. It is important to note that the state fund portion of the match is allocated in the Department of Behavioral Health and Developmental Disabilities budget, which administers the comprehensive and supports waiver on behalf of the Department of Community Health as part of our operational structure. An opportunity for public comment on the proposed change was held on February 15th, 2023 at 11 a.m. via Zoom audio. Written comments were due on or before March 13th, 2023. DCH received no oral or written comments on the proposed change. I'll pause here and would be happy to answer any questions at this time and respectfully request your final adoption of the proposed rate increase for comprehensive supports waiver program.
Questions, comments from the board, please? Hearing none, is there a motion for adoption, for final adoption approval?
Russell Crutchfield motions for approval.
Russell Crutchfield has made a motion for approval. Is there a second?
Dr. Lee seconds.
Dr. Lee seconds that motion. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you very much, Brian.
Thank you, sir.
Next, for consideration for initial adoption, Sonia Allen Smith, Inspector General, will make two presentations. And the first being Georgia Caregiver Registry, and you may proceed.
Thank you, Chairman Boyd. Can you confirm that you can hear me now?
Yes, I can hear you fine.
Okay, great. I am introducing a rule for initial adoption and approval. And the rule itself, the Caregiver Registry rule, is being amended primarily because we have relocated from 2 Peachtree to 2 MLK Drive. This amendment, as I mentioned, is to an existing rule, Rule 111-3-8-.05, regarding an applicant's or an employee's right to appeal a determination of employment and eligibility by the department. The Georgia Department of Community Health Caregiver Registry rule enables employers who are family members or guardians of elderly persons in Georgia to obtain an employment eligibility determination for applicants or employees who are providing personal care services to the employer's family members or wards. This amendment will update and make reference, as I mentioned, to the department's new mailing address, and will make reference to an online administrative form through which the applicant or employee may utilize to file an appeal. An opportunity for public comments will be held on May 10th, 2023 at 11 a.m. via Zoom. I respectfully request your approval. May I answer any questions, please?
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Roger Folsom, motion for approval, Mr. Chairman.
Yeah, Roger Folsom has made the motion for approval. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Sonia, you may move on to your next and final item.
Thank you, Chairman Boyd. The second item is an amendment to the estate recovery rule. This amendment is amending Rule 111-3-8-0.05 regarding the department's estate recovery efforts, which are required by federal law. This amendment updates and makes reference to the department's new mailing address for personal representatives to make written notification at least 30 days before dispersing assets of a Medicaid member. The amendment also provides for a department email address through which personal representatives may provide the department written notice. An opportunity for public comments will be held on May 17th, 2023 at 11 o'clock via Zoom. Again, I respectfully request your approval, and may I answer any questions for you, please?
Any questions, comments from the board? Hearing none, is there a motion for approval for initial adoption?
Motion for approval, Cynthia Rucker.
Motion for approval from Dr. Rucker. Is there a second?
Second, David Cruz.
David Cruz has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, and thank you very much for those presentations. Thank you.
Thank you.
Does anyone know of any new business that needs to come before the board at this time? Hearing none, would tell you that the next meeting will be on May 11 at 10:30, and hopefully have a different setting in our new office location. Thank you all very much for joining and participating this morning. Thank you and have a good day. Goodbye.
Thank you.
Thank
Thank you.